Assessment of the ovaries is a very important item in your ultrasound scan. And of course, after introduction of the transvaginal probe and getting the longitudinal section of the uterus, you have to rotate your probe 90 degrees and then angling it to the right and left sides to get the ovaries. Of course, it's very important to know how the polycystic ovary is appearing. And the polycystic ovary is giving that texture, as you can see here, multiple subcapsular atretic follicles arranged around a hyperechoic stroma. Multiple subcapsular because all of them are not extruded outside the ovary. Of course, they did not enlarge and they did not get the size of the dominant follicles to be extruded or to be erupted from the ovary, and that's why they are just arranged here around that hyperechoic stroma, and they are subcapsular and they are atretic, not exceeding 8 to 10 millimeters. So that's how the picture or the texture of the polycystic ovary, and sometimes they call it as necklace appearance. But it's not enough for diagnosis, of course. You should ask for hormonal profile for this lady to know if she is actually polycystic ovary, she has a polycystic ovary or not. Of course, after induction of ovulation, you may find a dominant follicle when you have a follow-up of this case, and so you can get a dominant follicle, and accordingly, she may get pregnant, and fertilization occurs, and accordingly, she can be pregnant, and even if she get pregnant and deliver once, twice, or many times, remember that because many ladies of polycystic ovaries are asking the same question, and now the polycystic ovaries are cured. That's the most common question when she delivered one, for example, she delivered a baby or two or even more. And so she thinks that after induction of ovulation and getting children, and she has got pregnant many times, that the polycystic ovary appearance would change. Actually, you should know that the polycystic ovary appearance by ultrasound does not change forever. It is the same picture. But of course, the most important is just to have a regular cycle, menstrual cycle, and to get pregnant. And so if you got induction of ovulation and you got a dominant follicle and you got pregnant and you delivered, so it's okay. It's fine. And that's the most important aim of your treatment.